They are making a difference on 938 Live.
When we think of organ donations, corneas rarely come into the picture. So we're going to find out more today. I talked to Professor Donald Tan. He is the Medical Director of Singapore Eye Bank and Senior Advisor and Senior Consultant at the Cornea Service at SNEC. Now, Prof, do you want to just bring us through who requires the donated corneas?
Well, in Singapore, we perform about 400 or probably 450 corneal transplants a year. About 2/3 of these are Singaporeans. So we're really looking at Singaporeans who need a cornea to have the transplant, approximately 350 patients. These are mostly elderly patients, and therefore the number has been rising quite considerably year to year, simply because of our aging population. But we also have a subset of the demographics also includes younger patients. These are teenagers to young adults because the cause of the corneal condition varies in these patients. These quite often are contact lens wearers who have got an infection or due to trauma. The cornea is right in the front aspect of the eye and it's the first to get hit by either road traffic accidents or industrial injuries, etc.
I think people tend to have a real ick factor when it comes to thinking of their eyes and being injured in the eye, and therefore don't like to think so much about what the Singapore Eye Bank actually does. Now, would you like to clarify some of the misconceptions there?
Well, yes. So, corneal injuries are not only very painful, but they do result in scarring or clouding of the cornea, and so patients can't see. And so corneal blindness is, although it's not perhaps the most common cause, it is quite an important cause of blindness because it also causes quite a lot of pain. What the Singapore Eye Bank does is, since its opening in the early 90s at the Singapore National Eye Centre, our goal is to procure corneas from healthy donors. These are usually people, what we call cadaveric donors, so people who passed away and have got healthy corneas, and we get permission to harvest the corneas from these deceased patients, and then we will transplant these corneas into people who require corneal transplants. That's the sole goal of the Singapore Eye Bank.
And I would imagine that actually dramatically changes the quality of life of the recipients.
Yes, absolutely. So, we will only transplant a cornea if the patient is blind. And so, of all the people don't die from eye diseases, but certainly visual disability is probably one of the largest, the biggest disability with a great impact, especially for young patients.
And what's the success rate like for the transplants?
Okay, there have been great developments and great improvements in corneal transplantation today. The field has changed, and we're not really, a lot of the times now, we're not transplanting the whole cornea. The cornea can be split or divided into different layers. So in some diseases, the front area of the cornea is damaged. In some other areas, in some other diseases, the inside layer, the cells on the inside layer of the cornea has aged. And that's one of the commonest causes, just aging of the eye. And so now corneal transplants are so developed that we can just exchange the inside layer or the front layers. And success rates for both these procedures are really in the high 90s now. So the transplant procedure can be extremely successful with very good success rates. And in fact, our program in Singapore, we have the Singapore Corneal Transplant Study, which is evaluating about 5,000 of these patients over a 20-25 year period. And our success rates are extremely high in the high 90s in the first year.
Looking at the demand, is there a shortage of cornea donations?
Yes, there is. Globally, there is a shortage around the whole world. There's some countries like the US in which they have excess corneas and they ship these corneas to different parts of the world, including Singapore. For us in Singapore, about a quarter of our cases of transplants actually get corneas from local Singaporeans. The rest, the Singapore Eye Bank has to import in from other eye banks in the region. We import corneas from the US, from the Philippines, and a few years ago, about 4 years ago, the Singapore Eye Bank started an eye bank in collaboration with Sri Lanka, with the Sri Lanka Ministry of Health, and we set up an eye bank there, and that is probably providing about half the corneas which we need for transplantation today. What we'd like to do is to change the ratio so that we get more local Singaporean corneas, which are more cost-effective, but also, obviously getting an internal source within Singapore provides for much greater stability in the long term.
I can imagine the conversation, though, with potential donors can become quite sensitive. What do you usually say to them? Should they be considering donating their corneas but might be a little bit on edge about it?
Sure. Well, I think there are quite a few misconceptions. Firstly, when somebody passes away, the relatives are very upset. There is this grieving period. And what they'd like to do is to expedite the process. When somebody passes away in hospital, for example, there are lots of things to be done. Signing the death certificate, organizing all the paperwork, and then getting the loved ones to the casket company or from the mortuary, and so that they can have, a wake, etc. And a lot of people think that if they donate the corneas, that means, a lot of delay. It's not true at all. We can perform the harvesting process in about half an hour. We'd like to perform it in the ward, at the bedside. We've gone to homes. We can go to hospices. It can be performed anywhere. Unlike all the other sort of, like kidney transplants and heart and liver, in which it's a complex operation. It takes many hours. Here, it really takes half an hour. More importantly, also, we ensure that there is no disfigurement. So we only take the corneas, we don't take the whole eye, and we place in place of the original cornea, we place an artificial cornea. And so the deceased person looks absolutely normal. You can have a normal open casket, and there is no indication that there's been any disfigurement at all.
And tomorrow on They Are Making a Difference, we'll hear from the father of one of the young cornea donors to the Singapore Eye Bank. Today we heard from Professor Donald Tan, Medical Director of Singapore Eye Bank, Senior Advisor and Senior Consultant at the Cornea Service at SNEC. This has been They Are Making a Difference. Thank you for tuning in. I'm Daphne Lim.
They Are Making a Difference on 938 Live.